What to expect on your first prenatal visit. Congratulations on your exciting journey into motherhood. The first prenatal visit is an eagerly anticipated milestone that sets the stage for a healthy and successful pregnancy. But what exactly can you expect during this visit? Welcome back to another episode of Omegy. In today's video, we'll talk about the things to expect on your first prenatal visit. So, without further ado, let's get started. The goals for the first prenatal visit. The first prenatal appointment is planned with several critical aims in mind to ensure that you and your baby receive the best possible care during the pregnancy. Your OB provider will first and foremost focus on learning about your medical history. Gathering information on any pre-existing medical conditions, past pregnancies, surgeries, allergies, medications, and family medical history is part of this process. Understanding your medical history allows your healthcare provider to adapt their care and make informed decisions for the duration of your pregnancy. Another important goal of the initial prenatal appointment is to ensure that you have received all essential OB treatments. Your healthcare practitioner will check your immunization records, including the influenza vaccine and TDAP, tetanus, diphtheria, and pertussis vaccine, and will advise you on any extra immunizations that may be necessary during pregnancy. They will also go over the significance of prenatal vitamins and correct nutrition in promoting your baby's growth and development. Furthermore, the initial prenatal appointment allows your healthcare professional to assist you prepare for the next 30 weeks and beyond. They will go over your expected schedule of prenatal appointments, routine tests, and screenings during your pregnancy. This ensures that you understand what to expect from medical appointments and procedures, making you feel more confident and prepared. They will also answer any concerns or questions you may have. They will advise you on how to live a healthy lifestyle, including exercise advice and tips for dealing with frequent pregnant discomforts. They may also outline potential pregnancy issues and warning signals to look out for, giving you the ability to take an active role in monitoring your health. Family medical history. One crucial component that your healthcare practitioner will inquire about at your first prenatal visit is your family medical history. This contains information about the health issues and diseases that your immediate family members, such as parents, siblings, and grandparents, have faced. Understanding your potential risk factors for some genetic illnesses or hereditary diseases requires an understanding of your family's medical history. Your healthcare professional can identify if any genetic predispositions may affect your pregnancy or the health of your baby by analyzing this information. Heart disease, diabetes, high blood pressure, some types of cancer, mental health disorders, autoimmune diseases, and birth defects are some of the specific conditions that your healthcare practitioner may inquire about. They may also inquire about any family history of pregnancy issues such as gestational diabetes, hypertension, or premature birth. Your healthcare provider can make informed judgments about your prenatal care and prescribe appropriate screenings or testing if they understand your family's medical history. If certain genetic diseases run in your family, for example, they may recommend genetic counseling or prenatal genetic testing to assess the risk of passing these conditions on to your baby. When discussing your family's medical history during your prenatal visit, it's critical to be as open and honest as possible. If you have any questions, don't be afraid to approach your family members for clarification. Remember that this information is private and must be kept confidential for your healthcare practitioner to offer you the greatest treatment and support possible throughout your pregnancy. Common lab tests at the first prenatal visit. Blood typing with Rh factor is one of the regular lab tests performed during the first prenatal appointment. Your blood type, A, B, AB, or O, and Rh factor, which are positive or negative, are determined by this test. Knowing your blood type is critical for recognizing any potential blood type differences between you and your kid. Another crucial test is to see if you are immune to rubella or German measles and varicella or chickenpox. It is critical to be immune to these infections since getting them during pregnancy might pose substantial hazards to the growing infant. If you are not immune, your healthcare professional may advise you to get vaccinated after giving birth to protect future pregnancies. Another typical lab test conducted at the initial prenatal appointment is sexually transmitted infection or STI screening. Screening for infections such as syphilis, HIV, hepatitis B, and chlamydia is part of this process. because certain infections can be passed to the fetus during pregnancy or delivery. Early detection and treatment of STIs is critical for the health of both you and your baby. During the first prenatal checkup, a urine test is also usually performed. This test evaluates your kidney function and screens for urinary tract infections or UTIs. The urine test also looks for the presence of blood, protein, glucose, and germs. Elevated levels of these compounds may signal underlying health issues that need to be evaluated and managed further. Genetic screening. Genetic screening is an important part of prenatal care since it helps identify your baby's risk of certain genetic illnesses or abnormalities. Two forms of genetic screening routinely used during pregnancy are carrier screening and first and second trimester screening for the baby. Individuals or couples who have a family history of genetic problems or who belong to certain ethnic groups with higher prevalence rates of specific disorders are often offered carrier screening. This screening will determine whether you or your partner have gene variants that are linked to illnesses including cystic fibrosis, sickle cell disease, Tay-Sachs disease, or thalassemia. Carrier screening assesses your baby's risk of inheriting these genetic diseases. The baby is screened in the first and second trimesters, often known as prenatal screening or prenatal testing, to check the possibility of chromosomal abnormalities such as Down syndrome and Edwards syndrome. Blood tests and ultrasound examinations are used in these screenings. During the first trimester, a combination test is performed, which evaluates particular hormones and proteins in your blood as well as an ultrasound measurement of the nuchal translucency, a fluid collection behind the baby's neck. A blood test called the quad screen is performed in the second trimester to assess the levels of numerous hormones and proteins. These tests cannot provide a clear diagnosis, but they can assist predict the chance of chromosomal abnormalities in the infant. Your healthcare provider may prescribe additional diagnostic tests, such as chorionic villus sampling, CVS, or amniocentesis if the results of carrier screening or first and second trimester screening show an elevated risk or create concern. Confirming gestational age and assigning an estimated date of delivery. Determining the gestational age accurately allows healthcare providers to monitor the course of your pregnancy, arrange appropriate care, and ensure your baby's healthy development. Your healthcare provider will assign an estimated due date, also known as the estimated date of delivery, if the gestational age is established. The EDD is commonly calculated by adding 280 days, or 40 weeks, to the first day of your LMP or by utilizing an ultrasound-determined gestational age. The EDD is used to track the progress of your pregnancy and to schedule prenatal appointments, tests, and screenings. And that's a wrap on today's video. Do you have any questions or reactions? Let us know in the comments section below. Please leave a like and subscribe. Thank you for watching, and we will see you in the next video.